All right. Well, we'll go ahead and get started here. My name is Amber Couch. I'm with Wellspring Financial Partners, and I just wanted to thank all of you for coming today and joining our webinar. With me, I have Bruce Tunze with Q&A, who will be presenting the Medicare A to Z workshop for 2024-2025. And you will notice that your cameras and microphones have been disabled. You can use the chat bubble. It should be maybe at the top of your screen or at the bottom of the screen. It'll look like a little chat bubble. Just if you have any questions during the webinar, go ahead and ask there. I'll present the questions to Bruce and he'll answer them throughout the webinar. If he doesn't answer right away, just keep in mind he might be answering it later on in the webinar. And we'll stop at the end of the webinar. He'll answer any remaining questions that are there. Also, just so you know, this webinar is being recorded. So either tomorrow or Friday, I will be sending you an email to all registrants with the recording. And if you have any questions at that time, feel free to let me know. If you have any feedback on the webinar, also please let me know. And with that, I'll just let Bruce get started here and introduce himself.
Well, thank you, Amber. My name is, as she said, Bruce Tunze. I'm with the Q&A group, which we doing business as Medicare A to Z. So like the slide says, we're so happy that you're here with us. We do value your time. So we're going to go ahead and get started because there's additional information this year. If you were on the webinar last year, there's some new stuff coming. You probably all heard that there's some changes between 2024 and 2025. So let's go ahead and get started and make sure that we don't get into your dinner hour. All right. So who are we? Who is Medicare A to Z? We're independent senior advisors. The most important word there is independent. And we'll talk about that. We're not just representing one company. We represent all the ones that we feel comfortable recommending here in Arizona. We're licensed certified Medicare brokers. There's an extensive testing every year through the America AHIP, we call it, America Health Insurance Plans, which is from Medicare, from the government, and then from each individual insurance company that we represent. It's a certification. Our office have over 75 years experience here in Southern Arizona, and we do offer a one-on-one concierge service, which we'll talk about right here. For new clients, I know there's some clients on the line here today. There's some folks that probably haven't heard about who we are, but if you're already a client, you know that we're going to ask you some questions, which I'll get to in just a moment, to do a comprehensive and complimentary Medicare evaluation for you with a review of your prescriptions and your doctors, the available plans, and then that helps us narrow down the choices and give you some guidance as far as finding a good plan for you. Because if you're talking to an individual from one company, they've got to try to fit you to their plan. We truly want to find the best fit for you. And I really don't care what company you end up with, as long as we're comfortable recommending that company and their support is what it should be. Then if it's a great fit for you, that's great. That's fine with me as well. Once you are a client, we are your advocate. We assist with billing issues and work when appropriate for pre-approval of procedures and do provide ongoing education. We have not just these types of educational webinars, but we have client webinars every year where we get a little more specific on the plans. And this is a good time to assure you this is not there's no sales today. This is strictly educational. We're not going to talk a lot about any particular companies. I will mention different companies as we're going through here, but we're not going to talk about specific benefits right here. We do consult and advise during open enrollment, which just officially started yesterday, with both new clients and existing ones about the appropriateness of their current plans and what new plans might be available. So what are those of us that are Medicare eligible? What are we most concerned about? All of these publications confirm that it's our health, our healthcare costs, our maladies, what we have to get treated. So we're all talking when we're meeting with our friends and neighbors. this is a topic of conversation for a lot of us. What about all the free things you see on TV? You know, you see Joe Namath and Jimmy Walker and William Shatner asking you and imploring you to call these 800 numbers, and then they put this wonderful screen up on the a wonderful page up on the screen for maybe 10 seconds, and you can't read it much better than you can see this. But here are some of the things that are on that screen. First of all, on the bottom there, that is a paid actor portrayal. On the top, it's a helpline. It's a private for-profit lead generation campaign that's not an insurance agency and broker or a broker. So if you give them information, that information is going to be sold to a licensed insurance agent who may or may not offer the plans that you're interested in, who may or may not be anywhere near Southern Arizona. Now they can go to Medicare.gov and look up, with a zip code, what plans we have available here, but that doesn't mean they really understand them if they're sitting in Pennsylvania or California or somewhere else. Dental and vision benefits are not guaranteed, only available in select plans. The bottom line is we know the local plans, what are available here in Pima County, Maricopa County, all across Arizona, and what what the benefits are, the extras that are built into the plans, and we're going to talk about all that as we go through the presentation today. So the information you get is not a complete description of the benefits, that is provided on those TV commercials asking you to call an 800 number. They also talk about getting money back in your Social Security check, and there are plans available like that right here in Pima County. In fact, in 2024, there's one that's going to give back up to $174.70 to your Social Security check. But of course, as we all know, there's no free lunch, so that particular plan doesn't have quite as rich of benefits as some of the others that are available. And Medicare has neither reviewed nor approved the material. So that's kind of what it says. So we encourage you not to call the 800 number, but to use a local broker. We can be that person, or if you have another local independent broker, that's great. Just use somebody that knows about the plans here. We're going to ask you, if we help you consult with you on your Medicare, we're going to ask you 5 questions. And we think that if you're talking to somebody else about Medicare options, they should be asking you these 5 questions or a version of these questions so that they have the information necessary to make a recommendation to you that makes sense for you and that's a good fit. So who are your doctors? We want to know, if you're looking at a Medicare Advantage plan particularly, who are your doctors that you see now and you'd like to continue to have access to? What medications are you taking? Do you have any chronic conditions? Are you a permanent resident of the county? And what are your travel habits? So what to look for in a broker, I've covered some of this. An independent broker that can do a needs analysis based upon those questions. Somebody local. You can ask your friend, neighbors, family members for a broker that they trust. And realize that a captive agent, somebody that represents one company only, can only sell you one product line. So again, they're trying to fit you to their plan, as opposed to finding the best fit for you regardless of the company. And realize that those TV commercials, of course, are just there to sell you something. And most of the stuff you get in your mailbox now is the same, regarding Medicare. It's just just trying to direct you to their plan. So when's the best time to review your options? Well, we just started yesterday with the annual enrollment period, October 15th to December 7th each and every year. Those dates don't change. And then you have an open enrollment period. Let me back up a second, though. This annual enrollment period applies specifically to Medicare Advantage plans and standalone prescription drug plans. For those of you who have a Medicare supplement, you probably also have a standalone prescription drug plan, and this is the time of year when you can make changes to those drug plans as well. Generally, you can't make changes for the rest of the year, except for the open enrollment period, which we'll talk about in just a second, unless you have a what's called a special enrollment period. If you move from Arizona to Indiana, then you're going to need, that's going to create a special enrollment period for you to change plans to something that's local to where you've moved. Okay. The open enrollment period is January 1st to March 31st. And this is something that was just added a few years ago to give you some additional options, and it applies to those who are currently on an MAPD or MA plan. So an MAPD is a Medicare Advantage prescription drug plan. Most of the Advantage plans here in Pima County have prescription drug coverage built in, so that's why they're called MAPDs, or just strictly an MA Medicare Advantage plan. So if we meet with somebody who has drugs available through the VA, the Veterans Administration, they may not need drug coverage. They can look at just an MA plan. And that's January 1st to March 31st. So what can you do during that period? You can make one change and one change only to your Medicare Advantage plan during that January 1st to March 31st open enrollment period. If you're in an Advantage plan with or without the drug coverage, you can switch to another Advantage plan, or you can disenroll from the Advantage plan and return to original Medicare. And you could sign up for a Medicare supplement if you wanted, and then you could join a prescription drug plan. But that's really all you can do during that open enrollment period. It's just for folks who, we run across folks all the time that call us in January and say, gee, my prescriptions, my one prescription that I have doubled or tripled in price. What's going on? Well, maybe they didn't look at their annual notice of change that they got from their Medicare Advantage company or their prescription drug plan and noticed that drug changed tiers or was taken off the formulary or whatever. So this period gives you a chance, if you're on an Advantage plan, to make one more change. It is confusing, right? The government is good at making things confusing. So how do you make sense of it all? Well, let's start with a little Medicare 101, original Medicare. You're all probably familiar with this card if you're on Medicare now, the red, white, and blue card, as we call it. You may have Part A and Part B effective dates, or just a Part A effective date if you're still working possibly and have health insurance through an employer. But this is this is what we call original Medicare. That's Part A and Part B. Part A is for hospitalization. Part B is for everything else, which we'll cover in just a moment in a little more detail. As far as the timeline, Medicare started in 1965. You can see seniors advocating here back in 1965 in New York for Medicare. It became law on July 30th. In the picture, you can see at that time President Johnson. To his left, our right, is probably recognized Harry Truman. He was the first Medicare recipient. Up on his card, you can see a signature there, and on the top right, the cost was $3 back in 1965, a little more than that now. And then just a little later, on September 1st of that same year, Medicare Part B was born. The original was Part A for the hospitalization part, and then Part B was added. And here President Johnson is receiving the first Part B application from the guy right next to him. So what is Part A? That's the hospital coverage. If you've been in the workforce or you're a spouse of somebody who's been in the workforce, there's generally no premium for Medicare Part A. It's automatic for most folks at age 65. It covers inpatient hospital stays, skilled nursing, home health services, hospice, and blood. Now, there is a deductible. If you have original Medicare only, there's a deductible. So if you go in the hospital, you're going to have a $1,632 deductible before it starts paying for any hospitalization. That's this year in 2024. We don't have a finalized number for 25, but it's projected to be around $1,684. And those projections are generally very close to the actual number. But they generally don't come out to about the middle of late October. Oh, question here. Let's look. Okay. Minnesota, there's somebody watching from Minnesota, and we do have ability to help folks in other areas of the country. Although we may, we can talk to you, we can put in your zip code, see what plans are available, and help you kind of narrow down the options, and they may refer you to an independent broker in that area if that is your primary residence, because generally you should sign up for Medicare in what is your primary residence. If you're a snowbird and you're here part of the year and they're part of the year, where does Social Security, what address does Social Security have? and the IRS, what address do they have as your primary residence? So I hope that addressed that. So go on to Part B. That is for medical, pretty much everything else. It covers doctor visits and specialists, outpatient hospital, durable medical equipment. This year, there's a $240 deductible, and the current projections predict about $257 next year in 2025 for that Part B deductible. And that is for pretty much anything except for the hospitalization, skilled nursing, hospice, and those types of things. Generally, an 80-20 coinsurance on Part B. So Medicare pays 80%, you pay 20%. And then the Part B premium, that is what you see if you're on Medicare now coming out of your Social Security check. The base amount this year is $174.70, so that's a number that many of you are probably familiar with. And we're hearing projections about $185 for 2025. And generally, again, like I said, that's going to be pretty close to what it actually ends up. So there are probably some of you out there that say, wait a minute, my Part B premium, whether it's coming out of a Social Security check or if you're not taking Social Security yet, if it's you get a quarterly bill, it's more than that. Well, why might it be more than that? It might be more than that because of an income-related monthly adjustment amount that we refer to as IRMA. And IRMA isn't always kind, but this is what IRMA means to you. If you're an individual, you can see on the left, if you're filing a joint tax return, whether or not your spouse is eligible for Medicare at this point, if you're filing a joint return, they're going to use that modified adjusted gross income for that return. And if you're over 206 on the joint return, then you're going to go from 174.70 up to the next level, which is 244.60. And you can see the different levels there, the income bands, and you can pay as much as $594 a month for Medicare Part B if you're in that top income bracket. Now, these amounts may change slightly as well. In 2025, we don't have those exact amounts yet, but just so you know that if you're paying more than the base premium, it's because you're making more than the base amount and in one of those other income levels. The cost of living adjustment has been announced officially, and that's going to be 2.5% for Social Security. That translates for the average Social Security check to about a $49 monthly increase. So let's talk about the different types of plans that are available to you through Medicare. First of all, we'll talk about Medicare Supplements, or as they're also known, Medigap plans. So if you hear somebody say, I have a Medigap plan, somebody else say, I have a Medicare Supplement, they're the same thing, okay? Two different names for the same type of policy. They're purchased through private insurance carriers to cover the gap between what Medicare pays and what your provider charges. So they're basically going to cover that 20%, they're going to cover that Part A deductible and so forth. There are 8 options, and this is where it gets a little confusing because we're talking about parts of Medicare. And if I talk about the parts of Medicare, A and B is original Medicare, D is drug coverage. We'll get to that after this section. And Part C is Medicare Advantage plans. We'll get to that a little later. So there are 4 parts to Medicare, but there are also Medicare plans when you talk about these Medicare supplements, A, B, D, G, K, L, M, and N. Some of you out there may have a Plan F. They're no longer available, but it doesn't mean you have to give up your Plan F. So there's different types of Medicare supplements. If you hear somebody say, I have a Plan G, sometimes they'll say Part G, but it's not Part G. It's a Plan G because they're talking about a Medicare supplement. And that's the most popular one now. That's kind of the Cadillac plan that's available now. This chart shows you the different supplements, and you see on the right side, C and F have been struck through because they are no longer available to folks who turned 65 after January 1st of 2020, as it says on the bottom there. I'm an example. I turned 65 in November of 21, so I was never eligible for a Plan F or a Plan C. The Plan F is the one that you hear somebody had a heart surgery or cancer or whatever, and they say, I never got a bill. It was great. I never got a bill. They're paying their monthly premium, but beyond that, the Plan F pays everything that Medicare doesn't. If you look over to the left where it says Plan G, that column. The only difference is the Part B deductible for Plan G is not covered. As I mentioned just a moment ago, the Part B deductible this year is $240. It's projected to be $257 or so next year. So it's still a very low out-of-pocket amount. You could literally have a $100,000, $200,000 medical bill with a Medicare Supplement Plan G and only have that Part B deductible out of pocket. Now, this does not include any prescription medication costs, but everything else, hospitalization, outpatient treatment, surgeries, whatever it might be, would be covered except for that Part B deductible in that Plan G, which again is the most popular one that's available now. So what are some of the pros and cons to those Medicare supplements? First of all, the biggest positive for most folks, and the reason that most folks choose a Medicare supplement or Medigap plan over a Medicare Advantage plan, is that they can see any doctor in the United States that accepts Medicare, and that's a great majority of the doctors all around the country. So you do have access to places like the Mayo Clinic, where with Medicare Advantage plans, you may not have access to all those types of facilities. There are limited out-of-pocket expenses, like I just mentioned, with just that Part B deductible as far as exposure for medical bills throughout the year. And then you don't ever need any referrals. And we'll talk about that referral situation a little bit more because it's changed over the last few years. We'll talk about that more when we get to the Medicare Advantage plans. What are some of the negatives or the cons with the Medicare supplements? You do have a premium. You have a monthly premium for Medicare supplements, and those do generally increase a bit each year. For a 65-year-old male non-smoker, we're looking at about $170 or so a month. And that's with United Healthcare, which is one of the Medicare supplements available here in Pima County. It's going to vary a little bit by company. But the thing about these supplements is a Plan G is a Plan G is a Plan G. The coverage is going to be identical regardless of which company you choose. They don't have built-in prescription coverage, so you do need to buy a separate prescription drug plan. Underwriting may apply if you are not in your initial enrollment period. So if you're turning 65 and you're going on to Medicare, or if you're leaving employer coverage after 65 and you're signing up for Medicare Part B for the first time so that you can go on to a Medicare supplement, it's called a guaranteed issue situation, which means you don't have to answer any health questions. But if you're already on Medicare and you want to change from one Medicare supplement to the other, or if you want to go from a Medicare Advantage plan to a Medicare supplement, generally health questions do apply. And there are limited additional benefits that you see with Medicare supplements. Some of them will have like a silver sneakers, or as United Healthcare calls it, a Renew Active gym membership and some other little discount programs, but they don't have the rich bells and whistles, I call them, or extra benefits that some of the Medicare Advantage plans do. You hear them talk on those commercials about dental coverage and vision and hearing aids and over-the-counter allowances for non-prescription items at the drugstore and all that type of thing. So those generally aren't built into the Medicare supplement or Medigap plans. One other thing I'll say about these, if you have a Medicare Supplement Plan F, I would encourage you to talk to the company that supplement is with and ask them if they will allow you to move to a Supplement Plan G. The reason being that I can guarantee you that the difference in premium between that Plan F and that same company's Plan G is going to be probably at least double what your exposure is. Because remember, we talked about your exposure under a Plan G is just that Part B deductible. So $240 to $250 a year. But the difference in premium between a Plan G and a Plan F with most of these companies is between $500 to $700 or $800 a year. So it doesn't make sense if you can move without answering health questions to pay $600, $700, $800 a year more for a plan that's only protecting a $240 deductible that you would have if you moved to the Plan G. And I hope that makes sense. So moving on, we're going to talk about Part D, as in drugs. So for prescription drugs, Medicare Part D was started in January 2006. Before that, there was no Medicare prescription drug plan available. So it provides those benefits. It's a voluntary program. But if I were presenting to you personally, you'd see me do quotes around voluntary because it's one of those government voluntary things where if you don't do it, there's a penalty. So how voluntary is it really, right? Uh, you may have heard about penalties, and people ask about those all the time and are concerned about those. If you don't sign up for Part B, as in boy, or Part D, this prescription drug coverage, when you are first eligible, which is at 65, unless you're on Social Security, which means you can do it earlier than 65, or Social Security disability, I should say, which means you can do it earlier than 65. Um, or if you're still working and you're 67 or 68 or 70 years old and you don't sign up when you leave that job, you might have a 1% per month penalty. But if you're working through an employer past age 65 and you had health insurance covered through that employer, and then you're 68 years old and you say, oh, I'm going to retire now and I'll sign up for Medicare Part B and Part D, then there wouldn't be a penalty because you've had what they call creditable coverage since you turned 65. Another question here, let's take a look. Income is determined for IRMA. The question is, how is your income determined for IRMA? It is what's called the modified adjusted gross income. And what exactly that is, it'd be a question for your accountant. But I'm glad you asked that because one thing I did forget to mention about IRMA is it's a 2-year look back. So if you're paying more than the base amount for your Part B premium in 2024, it's based upon your 2022 income. If you did have a year where your income was higher because you took a distribution from a retirement account possibly, or maybe in 22 you were working but you retired and you're no longer working, so your income is now lower and in one of the lower categories, you can actually appeal that without having to wait the full 2 years, and we could help you do that. But the IRMA is based upon the modified adjusted gross income. Thank you for that question. Okay, so drugs are generally categorized by tier when it comes to these Medicare prescription drug plans, and all companies have 5 tiers with preferred generics and generics, preferred brands and non-preferred brands, and specialty drugs. And some are now adding a select care drug, tier 6. Generally from tier 1 through 5, you're increasing the cost of the drug. So the more expensive drugs are going to be generally tier 3, 4, or 5. Some of the select care drugs are actually zero cost for some of the companies. They've just split some of those out. But the preferred brands and the non-preferred brands, those are the ones you see people singing about on TV, the Jardiance commercials and all of those. Those aren't the generics they're advertising in those drug commercials on TV. So this is the area where there are significant changes in 2025 over 2024. So we're going to spend a little more time here this year. And this is not meant to scare you, but you should have somebody who's trained on this help you navigate these changes because it is a little bit complicated. What we are happy to say is that we knew about the changes coming in the spring, but we didn't know how it would affect the plans until a few weeks ago because the insurance companies generally don't release their 2025 detailed benefits until at least the middle of September or 1st of October. So this chart, while it's kind of busy, I want to direct your attention to the left bar is the left box is 2024, the right is 2025. The right hand column on each of those is the catastrophic coverage phase. This year, you can see that the catastrophic coverage phase, you don't pay anything in that phase. If you went into the coverage gap, or the donut hole as it's called, in 2024, maybe you're now paying more for your drugs because you're in the coverage gap or donut hole and it's getting toward the end of the year and you're paying 25% of the cost of those as opposed to maybe a copay. Once you go beyond that donut hole or you go into the catastrophic coverage phase and you pay zero here in 2024. back in 2023 and before, you'd pay 5% of the cost of most drugs in the catastrophic coverage phase. So that was an improvement here for 2024. You'll see in that catastrophic coverage phase in 2024 that Medicare, the yellow, is paying 80% of the cost, and the drug plans, the insurance plans, that is, are paying 20% of the cost. If you go all the way over to the right to 2025, you'll see that Medicare's share is going to go down to 20%, and the drug plans are going to triple up to 60%, and the drug manufacturers are going to give a 20% discount. So Medicare's share is being cut in third, and the insurance company share is tripling. So who's going to pay for that? Well, we may have to pay a bit for that, but there's some more good news before we get to exactly how that's going to work. Here are some of the changes that have happened as a result of the Inflation Reduction Act. In 2023, you're probably aware of this for a lot of folks. Vaccine coverage was expanded. Insulin savings program was implemented, where if you're on insulin, you can get that at $35 a month. That it's capped at $35 a month. Now, not every insulin is capped at $35 a month. If the drug plan or the Advantage plan that you have, they have to have at least 2 insulins that they offer at that amount. Okay, so each one offers at least 2 drugs in each category. That of different types of conditions that one has and drugs that are used to treat it, they must offer at least 2 drugs in each category. In 2024, once you hit the catastrophic coverage phase, the cost for the remainder of the year, as I mentioned, is 0. It was previously that 5%. In 2025, here's the really good news, because right now in 2024, if you went through the donut hole and into the catastrophic coverage phase, you probably spent in the neighborhood of $6,000 to $8,000 out of your pocket to get there. In 2025, a $2,000 annual out-of-pocket maximum is being implemented. So that's a huge savings to folks that are paying for some of those really high-cost drugs. $2,000 is the most that anybody's going to pay out of pocket. After that $2,000, we saw in the previous slide that in 2025, the insurance companies are going to have to pay more than Medicare does. And so that's driving some of the changes that we're going to be talking about here for the 2025 plans. The donut hole is going away, or the coverage gap is going away in 2025 as well. So it's just purely possibly a deductible, and then initial coverage phase where you go up to $2,000, and once you're at $2,000, you're done. That could be in January or February. I did a drug evaluation for an individual this morning or yesterday that shows a $2,000 January payment and then 0 for the rest of the year because they're on one of those expensive drugs. Changes in the cost sharing with Medicare, going from paying 80% of the cost in 23 to 60%, as I mentioned, in 24 to 20% in 25. So what are the impacts on the Medicare Advantage prescription drug plans, MAPDs, and the prescription drug plans, the PDPs? You're going to see some cost increases, although I will tell you that the increases and the changes are less than we expected them to be when we knew about the changes that were coming, but we didn't know the plan details from the individual carriers. The Medicare Advantage plans have a broader set of benefits to adjust if need to kind of spread that cost. So we're not seeing as much, as many drug coverage changes with the Advantage plans. The prescription drug plans, the only way that they can, make any money is with the premium. So we're seeing some premium increases. We're seeing a reduction in the number of plans available for the prescription drug plans. In fact, this year in 2024, if I do a drug evaluation for you, I did one yesterday for somebody that's 65 in November. So they're going to have coverage starting in November of this year. So they'll have 2024 coverage for a couple of months before it rolls over to 2025. There's 20 or 22 different prescription drug plans available in Arizona in 2024. When I do a drug evaluation for 2025, and we can do those now that it's after October 1st, there's 10 plans available. So a lot of the plans have been, a lot of the companies have reduced the number of plans they're offering. Blue Cross Blue Shield of Arizona is getting out of the prescription drug plan business in 2025. So if you have a Blue Cross Blue Shield of Arizona prescription drug plan, you probably already got notification from them that they will not continue that plan in 25. So you'll need to find a suitable replacement. And of course, we can help you do that. Prescription drug plans, we have seen some premium increases. Others like SilverScript, which is an Aetna company, they're reducing their offerings from 3 plans in 24 to just 1 plan in 25. We're going to see more drug utilization reviews, more, so to speak, hoops to jump through. If you have an expensive drug, they may require a prior authorization, or step therapy when there's a more affordable drug, say drug A, B, and C, and A is the least expensive and C is the most. They may ask you to start with drug A before they pay for B, before they go to C. Quantity limits have always been required on some drugs, and we may see a little bit more of that going forward. Although I will say that with the drug evaluations I've been doing for existing clients, looking at 2025, the changes are not as dramatic and drastic as we had expected they might be. So we could actually see bigger changes between 2025 and 2026 than we are this year. There also is a Medicare prescription payment plan or a smoothing program. All prescription drugs, including Medicare prescription drug plans and Advantage plans with prescription drug coverage built in, are required to offer enrollees the option to pay out of pocket in the form of a capped monthly payment. So if you go to the pharmacy in January and you have a prescription drug and your copay or coinsurance, because possibly a deductible or whatever, is, I think it's $600 or over, you can call your insurance company and opt into this program, and they will, instead of you having to pay for that at the pharmacy, they will bill you monthly. So if that's $600 in January, they'll bill you monthly for the next 12 months at $50 a month. And if you pick up a prescription in February and the total is $300 for those, they'll divide that 300 by the next 11 months and bill you for that. And you pay the drug company or your insurance company instead of the pharmacy. Now remember, once you get to 2,000, you're done, so you don't have to worry about spending more than that. And this is not to save you money. It doesn't save you any money. It will just spread it out over the course of the year. So if financially, $500 or $600 bill in January is no big deal, you go ahead and pay it, and then you'll have less cost, throughout the rest of the year. And of course, no more cost once you get up to that $2,000 maximum out of pocket for your prescriptions. So let's look at the Inflation Reduction Act very briefly. There's 5 benefits. Regardless of your opinion of the legislation, there are some good things when it comes to Medicare. Some we already know about, requiring Medicare to negotiate certain drugs. That started. And these are the top 10, or the first 10 drugs that they negotiated prices for. And you can see significant differences in the list price and the negotiated price, saving hundreds and in some cases thousands of dollars. The Enbrel is from $71.06 down to $23.55. So big savings for some of these drugs. In fact, the Stelara, that's almost a $10,000, so about a $9,000 savings there. So very significant. I think that the folks, they figure that folks that are on these particular prescriptions, the Medicare beneficiaries that are taking these drugs, are going to save over $6 billion in 2025 based upon these 10 prescriptions alone. There will be, I think, 15 more drugs next year and then 15 more in 2026 negotiated. So we'll see drug price negotiation continue over the next few years, which will continue to help folks save money on their prescriptions. We've talked about the out-of-pocket maximum being capped at $22,000 here in 25. They are going to penalize drug companies that raise their prices higher than the rate of inflation. We'll see how that goes. Maybe harder than it sounds. Capping copays for insulin, we talked about that. That happened back in 23. And then we also talked about the Medicare approved vaccines like COVID and RSV and shingles and other vaccines that are now zero cost The shingles is a great example because that used to be, it could be a couple of $100 to get those 2 shingle shots, and now those are covered at 100%. So moving along to Medicare Part C. These are the Medicare Advantage plans. So when we talk about parts of Medicare, I said before, there are 4 parts, A, B, C, and D. A and B are original Medicare. Part D are the drug plans. We just talked a little bit about prescription drug plans. So what the Advantage plans do is they combine A and B and D, and at the bottom of the funnel comes the Medicare Advantage plan. So these are private health plans that contract with Medicare, and they must cover at least what original Medicare covers, what Part A and B covers, but most of them cover quite a bit more. And these are the plans that, 90% of the commercials you see on TV, if not more than that, are directed specifically toward these Medicare Advantage plans. And they're called the MAPDs, or Medicare Advantage Prescription Drug Plans. So the types of plans that are available are both HMOs and PPOs. So this is managed care. And however you feel about that, that's what it is. An HMO, you typically must stay in the provider network. You often do need a referral from your primary care physician, and they have little to no monthly premium. Most of the Medicare Advantage plans, most of the HMOs and some of the PPOs now here in Pima County are 0 premium. So you may be wondering, how can they offer a plan that has not only the Medicare required benefits, but benefits for dental and vision and hearing aids and an allowance every 3 months or every quarter for over-the-counter to spend at non-prescription items at the drugstore, a gym membership through Silver Sneakers. How can they provide all these benefits with little to no monthly premium? Well, what happens is, because you're contracting with an individual health insurance company like a United Healthcare, Aetna, Humana, Cigna, Blue Cross Blue Shield, they are now responsible for your health care. So if you remember when we talked about the Medicare supplements, that Medicare paid for 80% of your healthcare expenses on average, and then your Medicare supplement paid the rest, or most of the rest. Well, when you go within a Medicare Advantage plan, now Medicare, the government, is off the hook for that 80% of your healthcare expenses. So what they're doing is, when you sign up for an Advantage plan, that insurance company lets Medicare know, and Medicare pays them between $700 and $1,000 a month to provide money for your care. So that's where the premium is coming from. It's not that there isn't any premium, it's just that you're not having to pay a premium. And if you were living in Kansas or North Dakota or Wyoming, or somewhere where there's not as many retirees, where there's not as much population, you would see that the Medicare Advantage plans, number one, most of them do have maybe a monthly premium, some of them, $29, $79, $99 a month, and the benefits generally aren't as rich as they are here. But right here in Tucson, Arizona, in Pima County, and Maricopa County, where Phoenix is, and Pinal County in between, these are big counties with a lot of population. It's a big pie, so to speak, when it comes to the prospects for an insurance company. They all want a piece of the pie, so they make their benefits very, very competitive. So it's a great place to be a Medicare beneficiary, because the plans here are as good as they are anywhere in the country. And they're also good across the southern states, and in Texas and Florida, where there's a lot of retirees. The benefits are very rich. You also have the opportunity to go with a PPO as opposed to an HMO, because the HMO, you must stay in the network, the plan network. You often need a referral from your primary care physician. Now, I should probably change that to sometimes need a referral, because they have relaxed the referral rules. Most of the Medicare Advantage plans now, especially the HMOs used to require referrals. Many of them aren't requiring referrals anymore. And the reason, I think, is this: because many specialist offices are requiring referrals, whether or not the insurance plan does. So you call a cardiologist to make an appointment, and they'll say, hey, we need a referral from your primary care. And you may say, well, my insurance plan doesn't require that. And they may answer, well, we really don't care what your insurance plan requires. We require the referral because we want to make sure that you need to be here basically taking the doctor's time. We want to make sure that you really do need to be here. So they'll, many cases, ask for referral from your PCP. So the Advantage plans, they've kind of washed their hands of that responsibility. They don't have to be the bad guys anymore because in most cases, the specialist office is going to require it anyway. The PPOs do allow you to go in or out of network for care. With the HMO, if you're out of network, generally you don't have any benefits. With the PPO, you go out of network, you have benefits, but they're not going to be as rich as if you're in network. So you'll have a higher cost for out-of-network care. You don't need referrals with the HMO. Oh, I'm sorry, you don't need referrals with the PPO, but again, the specialist office probably will require them anyway. And you may have a monthly premium, although we have seen over the last couple of years more PPOs with zero premium here in Pima County and here in Arizona in general. The other thing I'll mention about the PPOs is not only is the out-of-network care more costly, but generally the in-network care is more costly. With the HMOs, for example, from the big 3 or 4, the United Healthcare, Aetna, Humana, Cigna, their out-of-pocket maximum for the most of the Medicare Advantage HMO plans here in Pima County is under $3,000. But if you're going to look at a PPO, that out-of-pocket maximum is going to be in the $4,000 to $5,000 range generally. And even some of the copays for, like a specialist visit or some of the, surgery copays or ambulance copays or hospital days in the hospital copays are generally going to be a little higher, even if you're in network with a PPO than with an HMO. Because you do have a little more flexibility. So I guess that's why they're doing that. A couple of other types of Medicare Advantage plans that are available are what we call SNPs, or special needs plans. There's chronic condition special needs plans that are for specific severe disabling chronic conditions like diabetes, congestive heart failure, asthma, COPD, some other things as well. Dual eligible SNPs, or special needs plans for beneficiaries who are entitled to both Medicare and Medicaid or access. I would venture to guess that if you're on this call and you're a client of Wellspring, you're probably not eligible for access, but those plans are out there. And then institutional special needs plans for eligible individuals who have been in the nursing care facility, long-term care, or skilled nursing facility for 90 days or longer. So those are special needs plans that are available, but a great majority of folks that are in Medicare Advantage plans are in either the HMOs or the PPOs that we showed here on this previous page. And I will say that nationwide, there are about twice as many people that enroll in the Medicare Advantage plans as do the Medicare Supplements. That being said, all the clients that I have that have been referred to me through Wellspring, it's probably flipped. There's probably twice as many Medicare Supplement beneficiaries as there are folks that choose Medicare Advantage plans, because a lot of folks want that flexibility. You're generally a little more affluent than the average population, and you might want that flexibility of going to any doctor anywhere. But I'm not here to tell you that one is better than the other. Again, we're going to talk to you about the differences in those plans, about your specific situation, what your needs are, and help you determine a good fit for you. What are the pros and cons of the Advantage plans? Well, we talked about little to no premiums with most of the Advantage plans. They are very predictable. They're very much like you're used to through an employer with co-pays and co-insurance. You pay so much to go to the doctor, so much to go to a specialist, so much for a day in the hospital, that type of thing. So you may not pay any premium up front, but then you have those co-pays and co-insurance until you get up to that maximum out-of-pocket amount for the year. Like I said, for the HMOs, generally under $3,000. You do have prescription coverage built into most of those plans. If you are eligible for the VA for your prescriptions, there are Medicare Advantage plans that don't have prescription drug coverage built in. And they do provide a lot of those additional benefits that original Medicare or the Medicare Supplements do not. Some of the cons, you may need referrals. Again, that is becoming less of a requirement from the plans. And you may need to stay in the health plans network. And with the HMOs, you definitely need to stay in the health plans network to have coverage. Do we have any questions, Amber? Not at the moment? Okay. So moving along. These are the companies here in Pima County that offer Medicare Advantage plans, and you can see the different types of plans that they are offering. HMOs, PPOs, and then the special needs plans, the chronic, which is the CSNP, and then the dual special needs plans. This is a good time to bring up, earlier we talked about all those commercials on TV. I just saw it again this morning. Every day you'll see a commercial from Humana talking about their great dual special needs plans. Well, you see there, Humana doesn't even offer a dual special needs plan here in Pima County, but of course they're showing the commercial everywhere. So those commercials can be a bit misleading. These Medicare Advantage plans, as well as the prescription drug plans, are rated with five-star rating system. This was started back with the Affordable Care Act back in 2010. And it's based upon things like customer service. You know, how satisfied are folks with calling customer service? Are they getting their questions answered? Is it simple? Is it easy to get your questions answered? Also, what percentage of folks are being readmitted to the hospital after they're discharged from the hospital? Are your customers actually getting healthier, or are they getting sicker? So all of those things go into the star rating. And we're not going to recommend any plans that are below 3 stars. Most all the Medicare Advantage plans and prescription drug plans are 3, 3.5, 4, 4.5 stars. We don't have any 5-star plans here in Pima County right now. But we have, from 3.5 to 4.5 are a great majority of the plans. We're never going to recommend a 1 or 2-star plan. If somebody else does to you, please run the opposite direction. Okay. We're just about done here, but just quickly, Medicare fraud, waste, and abuse. If you expect Medicare fraud or you suspect Medicare fraud, you can go to the Office of Inspector General website right there. Or an easier way to report it is just to call 1-800-MEDICARE. Here's some fraud tips. They're never going to contact you for your Medicare number or personal information. Medicare will never call you to sell you something. If you get a sales call promising you things, if you give your Medicare number, don't. That can lead to Medicare fraud. And it's not Medicare calling you. They're never going to visit you at home. You can't enroll over the phone unless you called them or unless you go to medicare.gov and you initiate that. So you might get, I had a client send me a copy of an email the other day from Medicare or Social Security. It says, click on this link to verify your information. Never, ever click on a suspicious link in an email. If you're going to go to ssa.gov for Social Security or medicare.gov, you go from your computer and you type in the address and you go there yourself. Check your EOBs. If you're getting an EOB from your insurance company regarding a procedure you had, I hear this all the time where somebody will call and say, my surgery is on there, but there's also another surgery. There's a knee replacement on there. I haven't had a knee replacement. Why is that on my EOB? Well, chances are that's Medicare fraud. Somebody might have got a hold of that individual's Medicare number. Once in a while, every once in a while, we'll see a doctor or a clinic somewhere around the country being prosecuted and possibly even jailed for Medicare fraud. This is a $50 to $100 billion a year problem in this country. Thankfully, our Social Security numbers aren't on our Medicare cards any longer, so they can't necessarily steal your identity if they get your Medicare number, but they certainly can use it to do illegal billings or fraudulent billings and those types of things. So anything suspicious, we encourage you to call 1-800-MEDICARE. I just want to remind you of that concierge service that we provide. We think it's a unique service that we provide to our clients. And a couple of things. First of all, what is the cost for that? The cost for that is zero. And I will point out also that if you talk to me about a particular plan and I recommend, you say, I want a Medicare Advantage plan, and I recommend a plan based upon the information you provide when I ask you those 5 questions. I recommend a United Healthcare Medicare Advantage plan. You can call United Healthcare directly and get that exact same plan with the exact same benefits. But what you don't get if you do that is you don't get me as your agent. You don't get this concierge service. If I help you sign up for that same plan, doesn't cost you anything, you get the same plan with the same benefits. I am in the United Healthcare system as your agent of record. That means that if we call your member services number together, or if I call them on your behalf, they're going to help me help you. If I call their member services number and ask about somebody who's not my client, they're not going to tell me a thing. So that's the reason why I encourage you to choose an independent agent, whether it's us or another independent agent that can be your advocate if you need help. We get people calling all the time that say, I got a bill that doesn't look right, or they told me something at the doctor's office or emergency room that doesn't sound right. We encourage you to call us first instead of calling an 800 number. And in many cases, we can get that problem handled because each of these companies have a representative that is specific to independent agents like myself. And they come to our office and they'll bring in lunch and they'll tell us about their wonderful plans. And they will encourage us, of course, to sell their plan. So that means when we go to them with a question, one of our clients has a question and needs some help, they are very motivated to help us help you because, of course, they want to keep us happy. So that is a simple reason why it's good to use an independent agent as opposed to going directly to the company. Instead of calling the 800 number, you call the local number. Now, sometimes we might have to refer you to member services or the 800 number, but in many cases we can help you out. We have a couple of questions here. How can we find the formulary for the specific plans? Generally, you can go, let's say you're searching United Healthcare or Aetna or Humana, you just go to their Medicare website and you type in, or you Google, let's say United Healthcare Medicare plans. You go in, it'll generally ask you your zip code or your location. You'll put that in and it'll show you the plans that are available. And then if you choose one of those plans and open up the detailed benefits, if you scroll down, generally there's a link there to the formulary, and it's a little different for each company, but that's generally how you would find it. You can also find the annual notice of change, what's changing on that plan between 24 and 25. Next question, for those on Medigap, which is a Medicare supplement, what possible options are there for dental and vision coverage? Dental and vision coverage is available on an individual basis. You can Google dental insurance, best dental insurance for seniors, and it'll bring up right here in what's the best here in Pima County or different options. Delta Dental, Emeritus, there's several different companies. We can also help you with that. So there are individual options for dental insurance. We also have folks that are still working, but they went on Medicare because the Medicare coverage was equal in cost and maybe richer in benefits or less expensive than their company-sponsored insurance was. And in some cases, I'll encourage them, well, keep your dental and vision coverage through work because that's not tied to your health insurance through work until you do retire. And then you can look at individual coverage. But there are options out there for those of you looking for dental and or vision coverage. Is that it as far as question?
We just got another one.
Okay, hang on a moment, folks.
Oh, he was just wanting to know if you can use the concierge service without being a Wellspring Financial Partners client.
Absolutely. Yes, you certainly can. And Wellspring is happy you're here, whether you're one of their clients or not. We're happy you're here. And if you reach out to us or to Wellspring, Amber can pass on my contact information. It's right here as well. That is my cell phone. That is my email address. I will let you know that if you have an Advantage plan or a Doug plan and you want us to look at that plan and see what the 2025 plan, how it compares and if that plan is still appropriate for you, please be patient. We have until December 7th. So whether we help you make a change today or on December 7th, it's not effective till January 1st. I will get back to you in the next week or by the end of the month at the very latest, and it will still give us well over a month to help you out. And I'm working through a lot of the drug evaluations and existing client requests that I have now, and getting through those a little quicker than expected. So I just want to make sure that you know that I will get back to you as soon as I possibly can, and we will still have plenty of time to effectively help you out. Any other questions, folks? We thank you so much for being here. Amber, is there anything else?
That's it. I just wanted to, again, thank you for everyone for being here tonight. And I'm sorry that we had some issues with the chat features. So I hope we got that all taken care of. If you do have more questions that you think of during the week or next week or anytime during the year, you can always reach out to me at acouch@wellspringfp.com, or you can reach out to Bruce Tunze directly, and I'll get you through to him. Did you have anything else?
One other thing I just thought of, and I know this happens on a regular basis. Some of you listening and watching may not be eligible for Medicare yet. Maybe you're eligible next year or the year after. So just want to let you know that you have a window when you sign up for Medicare. Let's say you're turning 65 next June, and it's on June 15th. So if you sign up for Medicare, it's going to be effective June 1st, because it's generally the first of the month, first of your birth month that you're turning 65. You can go into Social Security website, ssa.gov, on March 1st or after and sign up for Medicare, because you've got 3 months before your birth month, and then that birth month of June, and then 3 months after. And of course, we don't encourage you to wait till after, but you can start as early as 3 months before. So if you're turning 65 next year in June, and you want to talk to me about that, I would encourage you to reach out to me 1st of April. And that gives us plenty of time to help you get signed up for Part A and B if that's necessary, and to evaluate the different plans based upon your situation and find something that's a good fit for you. So that's all I have. Thank you so much. Anything else, Amber?
Oh, we do have another question here.
Okay.
Do you help an employee who retires and has a younger spouse that's not 65 yet, help with finding personal insurance for their spouse?
Yes, we do have a very good resource for that. He has an insurance agency here in town, and he does a little bit of Medicare and a whole lot of the under 65 individual health insurance. Most of that is done through healthcare.gov. But I will tell you, if you go to healthcare.gov and start filling out forms, your phone is going to start ringing relentlessly. Okay, so if, and I can refer you to that individual, he will reach out, doesn't cost you anything to use him. He will reach out to you and help your under 65 spouse find a suitable option. And then I can certainly help you with the Medicare piece. Thank you so much, folks. We appreciate your time.
Be sure to email me if you have any further questions. As I said, and I'll get them over to Bruce and he'll reach out to you directly. Thank you again.
Bye-bye.